Welcome back to HIP, Health Insurance Personalized, so-called consumer-driven healthcare. This is Consumer's Doctor on the behalf of foremost organization. We continue to stream live on several healthcare-related topics. Today's topic is large self-insured groups. Large self-insured groups. About 120 million Americans get coverage through a large self-insured employer-sponsored plans. Yes. However, the issues they face and the changes that would benefit the larger employer groups are very different from small, fully insured employers and purchasers of individual health policies. So they're quite different from large to small to individual. Yes. Today we focus is on large employer self-insured groups. The difference is the self-insured plans are regulated by a federal law called ERISA, which stands for Employee Retirement Income Security Act of 1974. 1974, folks. ERISA laws are very different from the more restrictive state laws and Obamacare laws. They are very different. Obamacare laws that regulate small groups and individual policies. So the Obamacare laws are for small groups and individual policies. Their focus is on individual policies. The major concern for the larger employers are related to some of the stifling Obamacare regulatory restrictions placed on them. Yes. For example, larger employers hire many part-time employees and others for seasonal needs. Obamacare requires full health insurance for employers who work more than 30 hours a week over a period of 120 days. That is the Obama rule. As a result, many employers have been forced to artificially limit the hours to many of the employees who can work. They are forced to. Obamacare also penalized larger self-insured employers for plans that were considered to be too expensive. They were considered to be too expensive. For example, many unions historically negotiated more health insurance benefits as more valuable than salary increases, folks. Salary increases. Obamacare taxed excess of 40%. This is called Cadillac tax on them. So Cadillac tax on the employers. So other issues faced by the larger employers center mostly on healthcare reforms needed rather than health insurance reforms. These include the need for transparency of medical service costs, medical quality standards, and tort reform to minimize excess costs for defensive medicine, especially for the healthcare professionals, folks. So personalized health insurance would help larger employers. They do. It is a foundation for a new health insurance system. Smaller employers and individuals have the same incentives as larger employers to utilization of medical services, lower utilization of medical services. Then all employers, large and small, all employers, large and small, employer groups, individuals, and associations would more effectively work together on common interests to change insurance and medical cost barriers to affordable care. To affordable care. There are three issues. There are three issues hurting the smaller groups and individual policies, folks. There are three issues. What are they? Number one, guaranteed issue. Guaranteed issue. This is for a smaller and individual policy. Number one is a guaranteed issue. Number two, coverage of the pre-existing conditions. And number three, single risk pools. These are the three things the larger employers do not face. Only the smaller individuals face. Again, I'll repeat those issues. Individual care, like a guaranteed issue. Number one. Number two, coverage of the pre-existing conditions. And single risk pools. Larger employers, under the ERISA law, is covered, but for the smaller employers, there is no law. ERISA law applies only for the larger employers. Let's go into more detail. Large employer groups, they do not need as much change related to these three issues. First is larger employers are sophisticated buyers, folks. They are sophisticated buyers, and they typically have large human resource departments, and the HR staff are schooled in healthcare laws and regulations. Staff usually have certifications, college degrees, and other diplomas related to insurance and healthcare. Larger employer groups hire outstanding consultants and brokers to keep up to date with benefit designs, laws, and regulations and related issues. They can afford that. What is the second one? Under ERISA law, employers and family members are not individually written. So guaranteed issue already exists with larger employer groups. So there is a guaranteed issue is already covered under ERISA. And third, ERISA requires coverage of the pre-existing conditions, folks. ERISA requires pre-existing conditions with minimal exclusions for limited periods. Coverage is guaranteed after 30 to 90-day waiting period. So if you work for a larger insured company, you are guaranteed insurance and coverage of the pre-existing conditions and employer subsidies, folks. What is the fourth one? Is the large self-insured employers are at their own risk pool. Remember, they are self-insured, means employer is at a risk for the claims of the employees and the family members. So they are all self-insured, folks. Therefore, only the experience of the employer group entered into the cost of insurance. So they're all self-insured, so they don't need to worry about it. Then you may ask, why don't we just use ERISA law for everyone? including the smaller groups and individual insurance. Well, ERISA is an unusual law. It was originally passed by Congress to help retirement plans. Later, Supreme Court decisions expanded the flexibilities of ERISA to self-insured health insurance plans, folks. That's what happened. They expanded to the self-insurance health group plans. So ERISA cannot be used because it requires employers to be self-insured. That means employers must assume the risk of their own claims. If the large claims occur from a single catastrophic health event, even from a single plan member, a smaller employer could go bankrupt. Yes, they could go bankrupt. In some ways, intent of Obamacare was to provide, that was the original intent of Obamacare, to provide ERISA-like protections of guaranteed issue and coverage of the pre-existing conditions for all. That was the original intent. To accomplish that goal, unfortunately, politicians and bureaucrats included too many market distortions. That's what happened. Too many market distortions and aberrations. So it didn't work for a smaller group employees. The way they thought it would, it did not work. So what have insurers, so-called insurance companies, and small, fully insured groups done to avoid Obamacare and mimic the benefits and flexibilities of the large self-insured groups under ERISA? You'll be amazed. Smaller groups are young and healthy if they can pass a risk segmentation test. So-called, it's an underwriting thing, folks. Right now, there's single risk. So if you do the risk segmentation test, they have option of using ERISA. If you segment the risk, they have options of using ERISA. You see, they found a legal loophole. They found a legal loophole in Obamacare. They have opted to implement a reinsurance program cleverly designed. Reinsurance can limit the potential liability from a single claim. So insurers now offer ERISA self-insured health insurance groups. They offer, insurance companies, they do offer self-insured health insurance to groups as few as 10 lives. So insurance companies have learned how to provide. So while these new self-insured products can benefit healthy small groups, they do not help others. That's the problem. They do not help others. Others with older and less healthy employers will see their premiums rise even faster as healthy groups opt out of Obamacare single risk pool. See, that's the problem. With a single risk pool, they opt out. To further complicate the situation, if a small group uses a self-insured option, later develops a large claims, they may be forced out of reinsurance program. See, that's another issue. They may be forced out of the reinsurance program. They then can re-enter Obamacare under Obamacare guaranteed issue mandate. They can re-enter into the Obamacare guaranteed issue mandate. But this is going to drive up the premiums for all fully insured health insurance plans. That's the problem. So it will drive up the premiums on the fully insured health plans. That's what happened. So this proves politicians trying to artificially control the markets will always fail. They cannot control the market. They always fail. Real reforms that use the power of competition and focus on consumers will succeed. We have to focus on the consumers, folks. It has to, and you have to have a competition. You cannot, and it has to be transparent. There's no doubt. So competition, transparency, and consumers are pivotal in the lowering the cost of the health premiums. So personalized health insurance has been carefully designed to create a free market solution that will work for everyone and provide an affordable insurance for all, folks. Affordable insurance for all. So basically, these large self insured groups need health care reform more than health insurance because they're self insured, but they need a health care reform to benefit the employers and consumers alike, especially the consumers. So the larger employer self insured groups would benefit from transparency of medical service costs, medical quality standards, and cost of defensive medicine, tort reform, so-called tort reform, to minimize the cost of defensive medicine. See, for healthcare professionals and healthcare facilities, that's very important. You need to have a transparency. You also need to have quality standards, and you need to minimize the cost because cost of practicing defensive medicine are too high. So we need to limit the liabilities for malpractice claims, folks. We need to limit the blood. Then only we will all succeed. So larger employer groups, they basically need health care reform. They do not need any insurance reform because they're already self-insured. If I'm making my point clear, so they need health care reform focusing on transparency, quality, and tort reform. Those are the three things we need to focus on in larger self-insured groups, larger employer groups. Folks, thank you for listening. I hope I made a point so that way you will understand what happened with Obamacare because it raised the premiums on average, folks. Raised the premium for most of the people who were insured already, but their premiums kept going up. That is what happened. So that's why Obamacare didn't succeed. Again, thank you for listening. This is Consumer's Doctor on personalized healthcare, so-called HIP. Health insurance personalized, consumer-driven care, demand control care. These are all the same terms to achieve a personalized healthcare. We will see you in the next episode. Thank you and goodbye.